Hello everyone, my name is Shalin and I'm going to be presenting to you today about an article from Medical News Today titled What are the Early Signs of COPD by Vadra Sonali. The article talks about making a diagnosis of COPD early on in the disease with the signs and symptoms, and also to begin an effective treatment early on to prevent the progression of the disease and improve the quality of life of the patient. Chronic obstructive pulmonary disease is a severe and progressive lung condition. There is no cure for COPD. However, with early diagnosis and appropriate treatment, we can significantly improve a patient's outlook and also reduce their risk of death, and also improve their quality of life. So let's begin with the definition of COPD. COPD is an abbreviation for chronic obstructive pulmonary disease. It is a progressive airway disease which causes airflow obstruction due to chronic inflammatory response from an external stimulus. COPD is a major cause of morbidity and mortality worldwide, and now it is a third leading cause of death in the United States. Let's take a review of the physiology of pulmonary system across lifespan, since COPD involves the pulmonary system. So let's talk about that. The development of lung begins inside the uterus and continues through adolescence until its full maturity in adulthood. The majority of the structural changes and development of the lung takes place early in the life. It begins during the embryonic period and it continues through fetal period until few years after birth. So major structural changes and development takes place before birth and few years after birth. That's like 1 to 2 years after birth. After birth, the development doesn't cease. The lung continues to increase in size and volume. So this increase in size results in massive increase in the capacity of the lung and also the gaseous exchange when compared to the function of lung at birth. So you can say it would have increased many times. The function of the lung is increased many times from the function of the lung at birth. The maximum capacity of lung is achieved during early adulthood, after which even in normal healthy individuals, the lung capacities start to decline. During late adulthood and with aging, normal mechanical changes in the body causes a decrease in the elasticity of the lung and the chest wall becomes stiff. There is also changes in the alveoli. The alveolar wall becomes thin and there is loss of capillaries in the alveoli. So these cause a decrease in surface area of the alveoli. So there will be a decreased gaseous exchange, and which leads to hypoxemia and the symptoms associated with it. So let's review some of the causes of COPD. So there are numerous causes documented. Some of them are cigarette smoking, environmental factors such as automobile air pollution, alpha-1 antitrypsin deficiency. It is a genetic condition and it affects the alveoli. Intravenous drug abuse causes pulmonary vascular damage, and the drugs responsible are methadone and methylphenidate. Immunodeficiency syndromes, vasculitis syndrome, connective tissue disorder. So let's review the pathophysiology of COPD. Pathologic changes in the COPD occurs in the bronchi, bronchioles, lung parenchyma as a result of exposure to harmful external stimuli such as cigarette smoking. So basically, COPD involves the entire lower respiratory tract. The irritants that are inspired triggers an inflammation in the airway. With the onset of inflammation, neutrophils, macrophages, and lymphocytes, they are released into the bronchial wall, and these activated mediators of inflammation release cytokines, and they cause damage of the bronchial lining and the mucus secreting glands in the bronchial wall. So the pathology of COPD, the inflammatory cells that are released in response to inflammation is a protective mechanism against an irritant. Every normal healthy individuals respond to an inflammation in this manner, whereas in COPD the inflammatory response is exaggerated, and they're overwhelmed that the body cannot handle the number of inflammatory mediators, and they lead to destruction of the lining of the airways and also the collapse of the airways. So the two terms commonly associated with COPD are chronic bronchitis and emphysema. So let's just briefly review the pathology of these two medical conditions. The narrowing of the airway leads to accumulation of exudates and mucus which cannot be cleared. This is the pathology of chronic bronchitis. Since the body cannot clear off the exudate, there will be a chronic cough. It's the body's attempt to clear it, but it won't be cleared. So patients with chronic bronchitis complain of chronic cough of over 3 months in a year. And the pathology of emphysema is the collapse of the alveoli lead to impaired gaseous exchange, which leads to hypoxia, and the symptoms associated with hypoxia: dyspnea, weakness, lethargy, fatigue. So now let's review the relationship between normal physiology and pathological phenomena of COPD across the lifespan. Smoking is considered as a major risk factor for the development of COPD. However, not all smokers are diagnosed with COPD, and many of the individuals who are diagnosed with COPD may not have smoked in their entire life. So this concludes that there should be other causes of COPD other than smoking. There are numerous studies conducted which shows that development of COPD is related to factors that begin even before birth. Any insult that during the development of lung, that is in utero, or after birth until the maturity of lung is completed, can pose a risk in an individual for the development of COPD. Prenatal risk factors are more likely to impair airway development, whereas postnatal factors tend to impact on subsequent airway growth as well as alveolarization and microvasculature. So the risk factors for COPD can be divided as prenatal risk factors and postnatal risk factors. Prenatal risk factors are maternal hypertension, prematurity, low birth weight, intrauterine growth restriction. The postnatal risk factors are exposure to smoking, either passive or active, environmental pollution, inadequate nutrition, viral illness, etc. So what is the clinical implication? Now we learned about the pathology, the physiology, the pathophysiology, the etiology. How are all these related? So the healthy pulmonary function in adults is dependent on normal lung development, which begins in utero and continues through mid-adulthood. When a pregnant woman is exposed to risk factors, as I mentioned earlier, the normal airway development is affected, leading to smaller lungs and reduced number of alveoli and abnormal structure of the alveoli. So the lungs is already abnormal because the pregnant woman is exposed to all these risk factors. When exposed to risk factors such as smoking, which happens after birth, the already compromised lung due to the insult in utero is unable to effectively defend the insult. So what are the early signs and symptoms of COPD? The signs and symptoms are chronic cough, excessive mucus production, dyspnea, tiredness, decreased physical activity, chest pain and tightness, wheezing or noisy breathing, and unintentional weight loss. Now that we learned about the physiology, etiology, pathology, pathophysiology of COPD, with this knowledge gained, we will be able to effectively manage and treat COPD so the individual can have a healthy life and delay the progression of the disease. So the management of COPD includes primary prevention and secondary prevention. Primary prevention involves identification of risk factors that hamper the normal lung development and intervene to prevent the exposure of these risk factors. So how can we do that? The pregnant women should be educated on prevention of prenatal risk factors to promote the developing baby's healthy lung development, and also we should include counseling on smoking cessation, nutrition, adequate prenatal care, close monitoring of the blood pressure during pregnancy. Secondary prevention involves identification of individuals who are at risk of developing COPD and controlling their environmental risk factor. We can delay the progression of the disease. So the high-risk individual who should undergo periodic examination of the lung function, early identification and treatment of the disease. These will decrease the burden of the long-term effects of COPD. In conclusion, COPD is a treatable and reversible condition if diagnosis is made at an early stage when the symptoms are not severe and the lung function is not significantly declined. The most rapid decline in lung function occurs in moderate to severe disease, so therefore diagnosis at an early stage of the disease helps to significantly reduce the morbidity and mortality associated with the disease. Thank you for listening to my presentation. I hope you enjoyed it.